Nasolacrimal duct obstruction, or Dacryostenosis, is an impairment of tear drainage from the eye into the nasal cavity caused by a blocked duct. This leads to persistent tearing and recurrent episodes of conjunctivitis and dacryocystitis. The goal of nasolacrimal duct probing is to mechanically dilate the narrowed segment of the nasolacrimal duct and to restore normal tear outflow. The patient is positioned lying down or semi-reclined, with the head slightly tilted back. Local anesthesia is performed. To dilate the lacrimal punctum, a cone-shaped lacrimal dilator of appropriate size is gently inserted into the lower punctum without excessive force. Next, a Bowman probe is introduced through the lower punctum. The probe is first advanced horizontally along the canaliculus, then rotated vertically toward the nose and guided downward through the nasolacrimal duct into the nasal cavity. A give-way sensation indicates that the lumen of the nasolacrimal duct has been successfully entered. Irrigation with a sterile solution is then performed through a cannula. The solution enters the nasal cavity, and the patient perceives liquid in the throat. Finally, antibacterial eye drops are instilled.